Okay. Okay, so one moment. This is my first live back since I was banned. Unfortunately, I got banned last July. My nose is just itchy. So I was banned last July because I was doing a penile treatment where I did penile lengthening with Botox, and it got me banned. It was very educational and medical. I just want to do my quick introduction. Okay. I'm sure not many people will show up. I finally was able to set this up to where I can be on my iPhone, so it's really exciting. This is just my what's it, name tag. I didn't have I have a Botox pin my mom had got me a few years ago, and I really loved it. But unfortunately, we don't get to use that today because I can't find it. So I just had this cute. I need to shave, okay? So I don't judge me. Okay, I have some scruffy. Is that what, can you guys see like that better? Okay, I'm gonna do my introduction. It says what? And you can follow me at Injector Tanner at every single social media you can think of. I don't know what that is. Every social media you can think of, okay? So, I'm here today. We're going to do these treatments. I've already marked up my face. I'm actually going to remove that. Let me do my quick little introduction. And I am a trilingual speaker. I speak 3 languages. It's actually partially why I do aesthetics in the first place. Okay, so I'm going to just do my quick introduction, and that will help you guys understand. I do have a lot of Korean and Chinese patients, hence why I would do such an introduction, okay? And I am going to just like go through that real fast. So, but that was like a part of my original video, like doing the part, sorry, that was a part of my video in the first place. I'm actually looking for one of my devices because it has a I just need one more device. Okay, so and then I'll get really started. Okay, give me one moment. Still not very cool. I didn't know you guys could see me over there. Is there any viewers? No, they're good. That is unfortunate. I really, really needed this device. I did write everything down. Please don't judge me for doing so. I just wrote everything down, so I'm going to read my introduction real quick. So, hi everyone, my name is Tanner Ayoob. I'm a Master Injector. Sorry, I'm not even looking at my script yet, so let me just get my script together. Okay, let's start with English first. Hello everyone, my name is Tanner Ayoob. I am an advanced medical aesthetic practitioner, master injector, educator, and founder of the House Called Beauty and the Aesthetic Mastery Academy. I specialize in advanced facial balancing, non-surgical rhinoplasty, full face rejuvenation, regenerative aesthetic medicine, and advanced injectable techniques, as well as bodily and enhancements using non-surgical. I've also done surgical procedures such as double eyelid surgery, non-incisional double eyelid surgery. Now that might sound like, oh my god, that's not surgical. It is. It's actually tougher than doing an incisional eyelid surgery. So I just want to point that out. And I loved doing it. And that was during my internship in Korea. I spent 9 weeks in Korea. And it was one of the most difficult experiences of my life. Okay, so let's keep going forward. I have completed, as I was going to say, I have completed extensive training throughout the United States and internationally, and I am passionate about plastic surgery. It's actually not plastic surgery. It's patient safety, anatomy, education, and advancing the field of aesthetic medicine. It is truly an honor to meet all of you. This is my new channel. My last channel had I had over 1 million views. I was doing very well. Oh, I was on like a high with how well I was doing, and then I posted a video of me doing patients. Sorry, I was like, my other back. It's either why am I freaking out? Sorry. I did a patient video, and the video ended up getting me a ban for nudity. Something I did not do. And also I find that ironic because I do respect this one doctor a lot. He's in West Hollywood. His name is irrelevant, but West Hollywood, gay man, has a new teen boyfriend. I do respect him so much, so please don't. I actually really respect him, and I'd love to be his friend. And I also would love to learn more from him in the future. Like, I want to actually meet him and become colleagues and have a mentorship. So I'm not talking bad about this man. I'm not gonna mention his name. Dr. J. Okay, Dr. J.E. Let's just say that. J, first name, A for Latin. He has porn stars in his videos on their hands and knees getting Botox, which is Botox to the anal muscles, which I actually do. Surprisingly, I do a lot of male aesthetic treatments. I never thought when I came into this that I would be doing men at all. It was never intriguing to me to do men treatments. I never found that to be my goal. Now it's one of my favorite, not Botox, penile enhancement. It's my favorite treatment to do. Out of all my treatments, it's my favorite. Just because it's so satisfying and you can, there's so many benefits to it. I don't know, I just really enjoy doing that treatment. I find it to be the most fulfilling for me. What else is fulfilling? Cleft palate repair, which is pro bono every time. That one is makes you cry after. It's really emotional. Maybe someone getting reconstructive. I just had a Lyft driver who she had been bit by a crane torso. That's the type of dog they're called. Anyway, her best friend's dog bit her in the face. She had, the surgeons did as best as they could. She actually is going to see me as a patient this upcoming month, so I'm excited to see her, and I will repair some of her lip as well, non-surgically. Non-surgical cleft palate repair is actually a thing too, by the way. A cleft palate, in general, the whole how it works is really interesting, and I find it to be a very, very rewarding treatment for both the patient and the provider. Okay, so it is truly an honor to meet all of you. I don't know if I just said this. I'm passionate about patient safety, anatomy, education, advancing the field of aesthetic medicine. That's like my goal. I've written a book. I have a book coming out. I have a publication coming out. I've got a lot coming out. I've got so many great things coming. So I'm really excited. So it's true. I want to meet all of you. I look forward to learning from you, sharing knowledge, and building lasting professional relationships and friendships. Thank you very much. Okay. Now into Korean. In Korean, my Korean introduction. 안녕하세요. Sorry. Let me get in the mood. Okay, I've been speaking Korean since I was 11. Sorry, it's like kind of far. Jay는. Oh my god, I'm not even nervous. Like I know this is what I'm writing. Wait a second. 안녕하세요. 안녕하세요. 이름은 Tanner Ayoob. I sound like I don't know what I'm saying. I'm so embarrassed. But I do. Ready? 안녕하세요. 저는 Tanner Ayoob. We just said that. 저는 I want this guys so bad. I sound like I don't know what I'm talking about. I speak Korean Chinese. Just had a phone call where one was speaking in Chinese and her friend was Korean. And I had to do the whole conversation and I did extremely well. I spent time there for 9 weeks. It was very hard country to be in. I was called Piggy. I was called lots of names. It was not a very nice country when it came down to being the surgical aspect of it. It was not the nicest place. Dr. Jung So Kim gave me this great opportunity. I had found him over from a prospective study, and I really, really appreciated it. And I love him so much. So Dr. Jung So Kim, he's the best. Yes, so 저는 아는 군항. Oh my god, I'm so sorry, everyone. I sound like I don't know what I'm saying, but I do. Okay, let me just get in there. 저는 아는 군항 시서 비수서 거상항을 굴 진제 근지 I'm so embarrassed. I'm out of my mind right now. Juvenation. Jade Sang Wei Hag Gorigo Gonan Go Do Ju Sa Sisul Junmun Iro 합니다. I sound like a 5-year-old reading in Korean. I'm embarrassed. 미국 고아 하에서 풀넓은 뼈를 받았으며 안전 회부학 묘을 그리고 메디컬에서 퇴직론 야외 불절의 sound awful. 장을 비지고 있습니다. 예으로 분을 만니게 도에고 매우 oh my god, can this be bigger? I wrote this. I actually wrote this myself. 입니다. 서로 배우고 시식을 오래도록 정주한 인연을 만들기 가기를 기대합니다. 감사합니다. I'm so sorry. That was so awful. Okay. Ready for my Chinese one? This is one I learned at 8. I started learning Korean at 11. So I do know what I'm saying. Ready? 大家好，我叫 Sorry. 大家好，我叫 Tanner Ayoob. 我是高级医学美容工业的计算知识医美专家教育者，也是 The House Called Beauty 和 The Aesthetic Master Academy 的创始人。我专注于面部整体整体美术设计，非说是容易换面部年轻化这上艺术内容以及高级 ，sorry， 对不起，最是知识。我上在美国几多个国家接受专业培训，对患者安全这和医学教育以及医学美容的发展充满热情，很高兴认识大家，希望能够向各位学习分享经验并建立长期的专业友谊。谢谢大家。So sorry， 对不起 ，I'm so sorry 。My Hangul and my 我的中文很不好 I hated it. I'm so sorry. That was embarrassing. Okay, well anyway. I use it not as much as I want to, okay? Like I want to use it way more than I do. Okay, y'all, here we go. We're gonna get started, okay? Let me just grab a little toothpick. Here's my toothpick. I have a little pack of mangoes right here. This is what I call a 25 gauge needle. Sorry, actually it's a 20 gauge. Use, of course. Okay, so here we go. Are you guys excited? I am. Oops. Okay. Well, that was embarrassing. Well, that'll be on the internet forever. I sound like a 5-year-old. I'm tired. Okay, here we go. Here we go. So, today's treatment. It's kind of a lot, right? I want to break it down into sections. Okay, here we go. So I'm going to start with Hyaluronidase. I'm actually going to type. I have an iPad with me. I love my iPad. I actually hated the iPad mini when I first got it. My first iPad was stolen. My iPad, actually, I was the original iPad kid. My grandpa, who's an amazing man, he told me if I got a certain grade in algebra in middle school, that he would do he would give me an iPad. So I think it was like the first iPad. And but if I go back in time, how old was I at 11? 2008. I just turned 29. Oh, I was eating the popsicle. But yeah, I turned 29 on June 3rd, 1997. I turned 29 this year, last month, okay? So, here's the situation. I have notes written for a reason, so we can just stay on track, because I do talk, and I talk, and I talk, and I talk. I used to get hundreds of thousands of views on live streams, and it was pretty crazy. So, I think when I start injecting, the live streams are going to come piling in, just like before. And if I do just double check right now, let's just see how many views. I think I've gotten 1 viewer. And my goal is, hey, let's get me back to where I was, because I was popping. I was really popping. Okay, I got no views. Poor guy. You're doing awesome, Tanner. Poor guy. Okay, well, how far are we into this thing so far? I haven't done a single thing yet. Okay, we're almost 30 minutes in. So you know what? It's time to move on. So here we go. So first step. I have written this down. I'm so sorry. I'm looking at an iPad. There's a reason why. It's because I want to. Did they ring back? I love working. I love being in my field of work. It actually makes me so happy. It brings me the most happiness I feel. Actually, is from work and helping people. I got 1 like now. Okay, here we go. So for the video title, full face rejuvenation, facial balancing live, advanced injection techniques with Tanner Ayoob. So hello everyone, welcome back to the channel. As I said, I'm a master injector and educator and founder of the House of Beauty and Aesthetic Master Academy. So today is going to be one of my favorite educational demonstrations, because we're performing comprehensive full facial rejuvenation, facial balancing using injectable modalities. And that includes bodily. That includes the body, actually. And I'm sorry, most people don't know. When you go to, when you're in a consultation with a patient, most people don't know, first off, the nose. They don't know about the nose, which is the most, it should be the more treated than it's not. Like, it is undertreated. I look at people right away, I'm like, your nose. But do I go like straight out going like, your nose is so... No, I would never do that. I go about it very, very politely. I go about everything very politely. And only if they ask, what do you think I should do? What do you think I should do? And what do you think I said, first off, what's your budget? That is the number 1 question you should ask. What is your budget, girl? Most of my patients are women. Actually, they're not mostly women at all. I don't know why I just said that. As I had said in the beginning, my most common procedure for men, and I have performed now 100 penile enhancements. So I would say that is around 800 nose job, a non-surgical rhinoplasty I've done. I've had over 1,500 patients and 4,700 clinical hours since I started. So I would say that so I was saying, right? If we're doing a facial um, and consultation, right? Full facial balancing consultation. If the patient can even afford a full facial balancing treatment, because that is expensive. That is what we would consider a more high costly treatment for the patient. Also, by the way, this stuff costs us just as much. What you're spending is probably what we do is 100% markup. And you're like, how dare you do 100% markup? No, how dare you not understand the costs that come in? We don't even get the 100% markup profit. That's not profit. That's not full profit because it actually gets subtracted from so many things. Rental, consumables. Oh my god! Don't even get me started on the word consumables. Consumables consume the income of medical practices, and then second to the consumables are, the products themselves. No, products themselves first, consumables second, insurance, licensing, all that stuff. Outside education, most offices, unlike, because I am the teacher, I actually mentor people and teach people and do hands-on. And I also do go to offices if they need training. I go to office and do full-day training for the full office. That these all come at different costs, of course, and you do get a certification at the end, and you get ongoing support. And I'm currently in the process of making a forum so I can have my students who are alumni of my courses. We can be able to all communicate and share knowledge and pearls, and I think that's what it's called, pearls, right? Pearls of knowledge that they can share with their with their colleagues, so we can all like talk and share. Patreon's a great place. YouTube's my favorite. Getting banned was a very big disappointment because I was hitting numbers. I got $200,000. Sorry, I didn't make a cent off YouTube, by the way. I never was planning on making money. It was just to educate other people. I got one video I did of my patient, her hyaluronidase of her upper lip, which was I would consider in the most extreme of improper placement. It was all improper placement. It had nothing to do with migration. It also had to do with my least favorite of all time lip product. And I love Restylane, okay? So my top 5, and I'll list them out. It's like top 6. I can do top 6 FDA approved fillers. And it's not this one. Actually, don't carry this product because of how much I hate it, okay? We do not carry Restylane Kiss, and I do not inject Restylane Kiss. It is my least favorite product ever. That is a hyaluronic acid-based product. That's FDA approved. It's my least favorite. Now, my favorites go in this order. Voluma, my OG, and number 1 girl. Go number 1 Voluma. My second one would be okay, I actually think it does go in this order. It would go Restylane Classic, Restylane Classic, same thing. Juvederm Velour. Restylane Lift, Radiesse, Restylane Silk, RJ3, RJ1. Those are my favorite products that are FDA approved in the United States. Evolysse, Evolysse, not my fave. RHA2 and RHA4. RHA4 is a little too weak for me. It's not, it doesn't have as much structure as I would hope a product of that type would have. It's not as structural as you would expect it to be. Volux, I love Volux as well. When using on the jawline, which we're going to use today, I'm going to actually do these procedures on myself. These red markings were for myself prior to doing this whole video. Damn it, I just had viewers and they have all the. Okay, so we're actually going to kind of start getting started, okay? I'm going to do full-on treatments today in front of you guys. That's what my old videos used to be like. This is not a tutorial. I am very educated, and I am proud of that. When I was 18 years old, I did not get the opportunity to go straight out to college. I was actually put into pretty situations no parent would want their child being put into. And I had to do things I had to do just to get to where I am today. That I'm proud of, actually, because if it wasn't for those things, I'm not embarrassed. I'm not going to tell you guys what they were, but I'm not embarrassed. They weren't illegal either, but I'm just saying, like, it was something I'm not proud of. Sorry, it's something I'm proud of that I did it. I'm proud of myself for doing it. It got me where I am today, but it's never got this business. So I will never be mentioning what I had done to get to my career today. It took years of 7 years now of hard work. Prior to that, it took years of emotional turmoil, which I'm still in emotional turmoil. Trying to continue to become a. I'm actually going to become a doctor, MD, a DO, or an MD or DO. I'm not sure yet. I got accepted. And so I'm so excited. Like, it was one of the best things that happened to me in May. I made it into a med program, and I'm so excited. And I can't wait. And it was 87% of graduates, or it was 93%. It was a really high percentage from my program. All actually end up becoming DOs or MDs. MDs or DOs. MDs are more common. DOs are also medical doctor. Sorry, medical degree is what MD stands for. PhD stands for it's the same thing as like what a doctor is, but they're not practicing medicine or diagnosing. So I'm actually going to become a doctor. I'm going to be a plastic surgeon. So that's my dream. It's going to happen. Okay. And I've been doing this career for 7 years. And I've been in the medical field for 7 years. Starting July 19th, 2019. Yep. Okay. So you guys are probably looking at me right now like, what does he need done? Look, first off, I have this hairnet on. I have a beautiful set of hair underneath. Like, literally. So I'm fine. I'm wearing a bouffant for a reason, because I wanted to just really show my anatomical features to you guys. I have beautiful hair. My dad was bald at 26. I'm 29 years old. Biggest fear ever growing up. Oh my god, going bald. Like, I'm gonna go bald. Like, my god. It never happened. But I do a lot to my hair. We're not going to get into that. Do you know why? Because we are on a really long, this is going to be a long ass live, okay? Let's just say that. Excuse my language. It's going to be a very long, tedious live for those who find this uninteresting. For those who find me interesting, this will be a great live, and you guys will love it. So let's keep this going, okay? Okay. Here's me without those markings. I need to shave. I have laser. Oh, and that's all fake tan that needs to come off. I could not get it off no matter how I tried earlier, okay? So please excuse it. Please don't judge me. Oh my god. Oh, I did. Okay, y'all. I'm actually from California, so I don't know why I just said y'all. Okay. So, here we go. Okay, everyone? So, first treatment we're going to do. We're actually going to start with hyaluronidase. Now, why am I going to do hyaluronidase? I also have this really cool camera. Can you see? Now, is it the best? No. Is AccuGain better? Hell yeah. This is an infrared camera. I think it's really cool on lighter skin patients. I'm actually a Fitzpatrick scale 4. I am of Middle Eastern descent. I'm Lebanese, so my dad is like Fitzpatrick scale 5. So if that tells you guys anything. I'm Fitzpatrick scale 4. I do avoid the sun it's like the most evil thing in the world. But this cool little thing like shows on lighter skin patients like me. My friend who's Mexican, she's my best friend. She was harder. I did see her. It was like kind of impossible to see. But if you do this in the correct lighting, you can see arterial things. Now, if the patient has filler like I do, I have your jaw's gonna drop. I'm 29 years old, right? Let me look straight at the camera. Oh, this is the camera. I'm pretty even, right? How many syringes do you think I have? I've had 278 syringes of dermal filler since I was 18 years old. So starting in 2016, my grandma, who has now passed away, she was the best grandma ever. She took me to, I actually saved up for this. I always knew I was going to get plastic surgery. I always knew I'd be a plastic surgeon. And so those dreams are coming true. So I wish she was here to see how far I've come. I actually have a photo of me at my first appointment, but if you guys want to see just real quick, she took this photo of me at my appointment. So she took me to my appointment. Did she tell my parents? No. This is my dad's mom. My dad is a great dad. He just has bipolar, manic depressive disorder, and it was difficult to grow up with, but it's fine, and I forgive him, and we are. I try to have a relationship, but we unfortunately don't. But that's okay. So, I mean, I really tried. He was very. Since I started injecting myself, again, I am a medical professional. I actually have 128 certifications. Here's my little brochure that tells you guys about me. I have 100. It says 127. I have 128 now. 4,500 clinical hours. Tanner Ayoob. 4,500 clinical hours. This is what got me into my medical program to become a doctor. 120 certifications earned and 204 procedures trained in. That includes surgical procedures. I was trained in non-surgical. This is surgical. I was trained in incisional eyelid surgery. I did it on 3 12-year-olds, 12, 13, and 16. They were gifts. This was in Korea. Incisional eyelid surgery. Non-incisional is more difficult. That's when you use a thread. I actually had a patient recently. She's Korean. She had it done in Korea, and oh my god, I would never knew that she even had it done. It was so well done, just like my work. And it says I'm expertise in training in neuromodulators, dermal fillers, biostimulators, skin boosters, laser and light therapy. Actually started with lasers. My first was a 3-week program certification course. Was again, you have to be a medical professional, but my first course was with Katera laser. I love Candela lasers. I love Katera. They're my heart and soul. skin rejuvenation, body contouring, intimate rejuvenation. I do a lot of penile, and I've even done labial work, vaginal work, advanced injectable techniques, anatomy, and ultrasound. And we carry Botox, Dysport, Xeomin, Daxxify, Jeuveau, Letybo, Juvederm, Restylane, Radiesse, Sculpture, Kybella, and Skin Beef. Now, there's more than just that nowadays that has been released. There's Evolase. It's from Jeuveau's company, Evolent. They released Evolase. Magic Q is by Obagi. Obagi released their own dermal filler. It's called Seifa Abroad. I've used Abroad fillers, and I'm really accustomed to the Korean market. That's why I was so excited when Letybo became, which I'm going to be doing today. I was really excited when Letybo became approved because I'd used it so many times and it's so popular. Now the thing is, their market is so awesome. Those biotech companies are just at a whole nother level over America. It's not all about money there either. I just love everything about Korean biotech, Korean pharmaceuticals in general. I just love everything about how they go about everything. So as you're looking at me, I drew a circle here. I think I need to remove filler there. Let's look at this together. I have a mirror. Here it is. This is not the biggest mirror in the world. Oop, and it does not look the cleanest either. Let me clean this up. I got some really cool stuff to show you guys today. So please do stay around if you can. I'm going to be even doing my knee. I had a thing called bursitis, and it left me with a horrible atrophic. It's called atrophic. It would call atrophic scarring. A scar. Atrophic scar is like when someone has an acne scar that's pitted. That's it. I actually had that occur in my knee after I had this thing called bursitis. Bursitis is horrible. I could barely work, and I actually was forced to work because I had to pay my bills. I forced myself to work while under bursitis. I can't. Mike! Oh my God, how are you? Oh my God, how are you? Oh my gosh, I'm so happy to see you. Wow, do you notice I remember you? Like, isn't that crazy? That's so cool. Oh my gosh, I'm so glad you found me. That is such an honor. Oh my God, that made my day. Oh my God, thank you so much. Oh my God, I'm just so happy to see you. Thank you for all of your support before. I'm doing okay. I've got business has not been going. It's been really slow this summer for some reason. Finances have been really slow and hard, but besides that, I start university again next month. I made it into a medical program, prestigious one here in San Francisco, as one you guys can probably guess which one. And and then 90% of graduates become MDs or DOs, so I'm really excited to become a plastic surgeon, hopefully one day when I do my residency. And yeah, so that was my best news of the year so far. But since I saw you guys last was July or August, I think it was August last year. I'm really happy to see you too. Please subscribe and please stay around if you get interested, because I'm actually going to do some interesting stuff. I'm so sorry I'm so boring right now. I just was trying to get introduce myself again because I unfortunately was banned. Do you know why I was banned? I'm curious. Do you know why? Were you there when I got banned? Oh, thank you so much, Kim Mike. That means a lot to me. Thank you so much. And please give it a thumbs up if you could too. That would mean so much to me. Yeah, thumbs up and a subscribe. No, I was wondering, okay. So I'll tell you real quick what happened. I do a lot of penile enhancement now. Do you know if you know what that is? It's penile enhancement is when you do dermal fillers, including in toxin. You can do tox too. To certain there's a so this is a replacement of surgical penile enhancements. So surgical wise, they would do autologous fat grafting, where they take fat from maybe your pubic bone area and then inject it into the penis shaft, the penile shaft. And then after that, those results that has really fallen out of favor, okay? So now they do penile filler, and it's usually now, because of hyaluronic acid safety profile and how it can be reversed. It just doesn't mean you could just willy-nilly inject like shit. You just do a shit job and then, okay, I can reverse it, you know. But I've been doing a lot of penile filler, and at the time, I was doing a substantial amount of it. I still do it quite often. If I get a male patient, it is for penile filler. So that is a really great compliment. It's usually from people actually Googling me, and finding out about me. Like I just had a patient he left his provider, he lives here. He flew from San Francisco down to Huntington Beach. It's near LA. I know that you're in New York City, because I used to live in New York City too. And he would fly down to Huntington, right? And he has a family of 3 kids, all that. And I know, it's expensive. It's quite an expensive treatment. So the reason I'm bringing all this up, okay, is because this one patient of mine, he, in exchange for a discount, would let me film his stuff. So I would film his procedures, right? And they usually involve the penis. And that's okay because I started making a substantial change in his, I did a really great job. And unfortunately, one day, this was right before something tragic happened, actually. So I'll get into that. Yes, I remembered you in New York. Isn't it? Yeah, I remember everything. So he ended up wanting, okay, so just real quick, I'm so sorry for this long explanation. Real fast. Penile filler does give length. It does give length to the penis, but it's more for girth and circumference to enlarge it. And when you do penile filler, the weight of the penile filler itself, the weight that occurs, it does actually create length. I've noticed it myself. They say that it doesn't. Okay, clinically, I've seen it. I also have penile filler myself. I did it myself, so I know that does create length. I know I shouldn't be talking about that, but I've done it myself. Actually, every provider of penile filler I know has done their own penile filler. So he ended up sitting on camera for me. So medical. Everything was so medical expertise. Everything was very, very to the point medical. Nothing was sexualized at all. He's sitting on a sterile clinical setting too. Like everything was just so clinical and like medical. And that's unfortunate because like Dr. Jason Emmer, do you know Dr. I don't know if you know, you guys Google him. You can see how sexualized his videos are. Also Injector Chris. Okay, I'm not saying anything bad about them. I actually really like Injector Chris and Dr. Jason Emmer. I really respect them. I've actually, just because Injector Chris is closer to my age, I've actually known about him for years before I even became an injector. He's actually a doctor of nursing in New York City. And he was okay, so I'm bringing all this up because they're more like out there with their things and stuff, and they don't get banned. But I did one time where I did penile tox. So there's a ligament surgery where they cut the ligament, they sever the ligament, and the penile shaft drops, and you get length. I did Botox to him on camera. This is all I did. was the Botox on camera, but I was allowed to post penile filler treatments. So this doesn't make sense to me why I got banned. I was on a live. Maybe I should have done it on a live. And I did on a live, and I got banned. I lost all millions of my views. I was doing really well at that point. Like, I was popping. And today, I just had to, like, I only have 13 subscribers, I know. And I am using my iPhone as a, oh, actually, wait, I can't show you because I literally using my iPhone as a thing. I'm not even allowed to, like, stream on my phone. Like, or mobilely, like, I can't use my iPad. I can't use my iPad. I can't use my phone because it doesn't. They won't let me. I'm banned from doing that until I reach 50 subscribers, which sucks. So I was like, okay, today I'm like, you know what, Tanner, I'm going back on. I'm gonna start doing it again. And so I'm back today. So yeah, I got banned over penile tox, and it was just to help a man. And he was. Then guess what happened? I've never injured, out of any of my 1,500 patients, I've never injured a patient. I've had weird occurrences happen. Everyone who does injections has these weird things happen. Everyone's biologically different, okay? So this patient ended up, do you know what the worst type of complication is? Would you know what every injector fears? Besides blindness, embolism, pulmonary embolism, the thing when it travels through the lungs and you can't breathe, like that type of stuff is like the scariest. But there's like this one really common, and not common, but like really scary thing that we all fear. It's called a vascular occlusion. Okay, it's when you do you intravascularly inject into a blood vessel, and you end up causing severe damage. The person can go blind first off. Well, even the lips, you can go blind. The nose is like the worst. Here is the worst in the forehead. Okay, and which I will be doing today on this video of myself. But he got a penile vascular occlusion from me, and I was able to reverse it. He even went to UCSF, my future school, which is exciting. And they ended up telling him I actually did everything correct, that there was not one thing I did wrong. And that is such like a compliment, like coming from a urology center specializing in urology in San Francisco, because that is like a huge deal. That's just a huge deal, you know? So I was really honored by that. I saved his it actually started because I had injected over the pubic bone. He had an indentation. I filled the indentation with a needle. Caused it. I was actually going to post the video. So I will be posting that video. Maybe if you're interested and want to see about it, I will be posting it very soon. And I'm now going to actually get started with this treatment, okay? So this is the side of my face, everyone. I hope you will watch because it'll be interesting. I actually have the treatment when I still have the vascular occlusion dissolving and everything. I have everything. I filmed it all because the patient lets me. So this is my face. Okay, sorry. Oh shoot, how am I gonna do this? Oh, maybe I do this. Here's my face. Oh my god. Well, that ain't working. Let's do it like this. Maybe keep it still. That didn't work. Sorry. Let's do it like this. Thank you. Thank you so much. Let's do it like this. This is my face. I just need to like see it. Can you guys see it? Oh gosh, I need to like get lower. Just like. This is my side profile. Is there anything you would change? I know that doesn't look like it. I just feel like okay, so oops, sorry guys. You actually can't really tell, Thank you. And I look crazy because I'm wearing this, but I have really nice hair. Like, my hair volume's amazing, and just like, my hair looks awful because it was in a bouffant. That's what they're called, bouffants. A hair cap, obviously. I look awful. Did you see my new photo for the thumbnail? That's how I really look normally. So I'm not even joking. Like, I literally look like that. That was not an AI photo. That was actually a photo shoot. So I look, I just look a really, I had marker on my face, so that's why I look a little red. I just took it off just to redo all this. So, oh, you're so sweet to me, Cam Mike. Thank you. That's really me. That was me like a week ago. So, okay, so I put the bouffant on just to really show my anatomical features. I did inject my forehead last night, okay? I'm also going to be doing my knee. This knee. I had a thing called bursitis. Oh, that's so sweet of you. You're the best. I had a serious thing occur, this bursitis. It left a trophic thinning of my skin in the middle of my knee. When it comes down to the knee part, I'm actually gonna like show you guys. I forgot. I'm not wearing pants. I'm wearing underwear, so let's just do it like this. I really want to do my knee, okay? Oh my god, I keep forgetting. I'm wearing underwear. I need to put shorts on. So give me 1 second. I'm also on a leather chair, my treatment chair. So that's what that sound was, okay? Okay. So, my knee. The knee. So this knee suffered bursitis. It was really bad. I've actually done such an improvement. Like, it looked like an old lady knee. Let me see if I can show you guys. Actually, it doesn't look that bad anymore. But I had it in January, and I've had it one other time before this in September of last year. Sorry, 2024. It was really bad. So it kind of does have that old lady wrinkly knee thing looking. I'm gonna take a photo. I hate it. Let me tell you that right now, okay? I've made such an improvement. It's actually crazy. Yes, I actually did. It's called housemaid's knee. So I was cleaning, like that's what they referred it to as in the olden days. Okay, so like the difference between both knees is astonishing. Like, here, I'm taking a photo. But I've done such an improvement. Like it was worse. Oh, and by the way, bursitis was the most painful and debilitating thing I've ever gone through. Like, besides, like I've actually been sick before, and I was hospitalized and everything for like 3 weeks straight. So I've been sick, but this was awful. Okay, let me tell you that right now. So okay, here's my knee. So it left a bunch of atrophic like thinning of the skin. Wow, this background like really shows. This is what my knee looks like right now. It was worse. I have photos I can show you. I actually have videos of me. You're supposed to go to a orthopedic person. I drained it myself because I'm a medical professional. Actually knew what I was doing, and the first attempt I did it correctly. So I have the video. I'll show you in a moment. But this is what my knee looks like right now, and that does not look cute, right? It looks dry. I microneedled it. That's also why it's kind of peeling, okay? But look at how like, ew. And then I've actually filled it with dermal filler multiple times. And then here's my normal knee. Healthy knee. Bad knee. Healthy knee. Bad knee. So I'm actually going to put those side by side. on this app called PhotoGrid. I love this app. It's an amazing app. PhotoGrid is awesome. So I'm just gonna put those side by side real fast so we can have like a comparison, you know. And then I'm gonna actually inject this, and I actually want to do it like right away. So I was gonna show you guys how I map out everything. I think that would be best to do. Okay, how did I do them on myself? First off, from the expertise that so let's go with the knee first, right? The bursitis knee. I just anatomically, I know every part of the body. I've done these things called cadaver courses. When you submit your body to science, your body is used for every inch of your body is used for science. So, for example, there's a product called Renuva. Okay, it was originally made for like diabetics who had ulceratic injuries, ulcers in their foot. They lost adipose tissue. They lost tissue from their feet, and that becomes painful, right? And at the bottom of the plantar, the base of the soles of the feet, they lost parts of the foot, right? So, and they like lost like the fat that like cushions you when you're walking. So when you donate your body science, for example, they liposuction the fat out, and they use that fat for a product called Renuva. Renuva was also called, before it was cosmetically approved, because it's now cosmetically approved, it was called, before it was called cosmetic approval, it was called, well, when you look up Renuva, it brings up revenue. Renuva pre-cosmetic approval. They like to call it different things, like an injectable adipose fat matrix designed. The fat matrix is dead people's liposuction fat being re-injected into living human beings. It's a biological scaffold that, so like your fat does hold growth factors and proteins, and fat is very hydrating. So fat is hydrating. Like if you eat fat, it's hydrating. Your brain is mostly fat, for example. So they now use it for breast irregularities, body contouring, hand rejuvenation. They use it for non-surgical BBLs, facial hollowing. But it was before, it was called a product. It was for diabetics, feet. Can someone tell me what the name was? Because it has another name. This will all tie into play in what I'm trying to say, okay? Okay. Lipoderma, dermaclay, and alloclay. Alloclay is, I'm pretty sure, what the name was in America. So anyway, they use it, right? Injectable adipose matrix, off-the-shelf fat transfer, fat graft, fat stimulator, allogenic fat transfer. Those are what those are called. But it's just fat, dead people's fat, lipo it out. Okay, and then it's obviously they do a manufacturing. They do a type of manufacturization of it. Okay, so I brought that all up for a reason. So in the knee, the bursitis part, I've done cadaver courses. So I've dissected dead bodies 6 or 7 times. I have a red mark because I drew. I'm gonna draw there again with a red marker, but that's what that's from. We did cadavers. One course we did was we caused blunt force trauma to the cadaver to see what would happen in the face if an accident would occur. And yes, my toothpick is a 20 gauge needle for these mangoes. So that was just like one for the face, right? I actually have the video of me doing it to my knee. It's a very interesting video if you want to see. So it was very, very awful, painful a disorder. Bursitis is absolutely awful. I mean, it is beyond. Um, I can't believe the human body would do that to you. It was so painful. I have it on one of my. I have 8 phones, cell phones for the house called Beauty and Me. I also have 8 phones. Isn't that crazy? 8 iPhones. Not bragging or anything. I couldn't even pay my bill this month, so if that tells you guys how things have been going, my career's going fabulous. I'm really happy with my career. I'm just making a joke that it's just been really slow. Okay, so for the bursitis knee, I knew exactly where to go because I do knee filler. We do extremities. You probably don't know. You can do the elbows, the earlobes, the hands, and the knees, even the tops of the feet with fillers. And when you do that, you can get quite dramatic. Yeah, I have videos of me draining it right here. I just found them. So I had already I already know what's in that region, safety wise. So I knew exactly where the prepatellar bursa pad is. The bursitis is from bursa pads. You have around 78 of them in your body. They cushion between the joints, and they're like liquid filled. If they get inflamed, like the ones in the shoulder really gets inflamed apparently in the shoulder. It's like, oh God, it's like so painful. But that knee one, your knee swells up like a balloon. It is so freaking painful. I had to be on. I was on pain medication. On top of non-steroidal anti-inflammatory. So I was on pain medication, opioid pain medication, and non-steroidal anti-inflammatories. And it was so painful, and I just like could not deal. Like it was a really, really miserable experience. And it was just god awfully painful. I don't understand. So it was from me cleaning too much. I cleaned too much. And then for the penile filler, because I do the penile filler so much, I was like, hey, this kind of looks good. I'm going to do it to myself. And I swear every provider I know has done it to themselves. Like everyone. And some of them admit, I've overdone it. I actually have videos of me doing my penile filler on here right now. I won't show it because I don't want to get banned again. I actually really want to recreate my I want to rebuild my reputation. Here's like a bloody version of me doing it. Here, I'm gonna show you just a part of me doing my bursa. But the penile one's pretty easy to do if you know the anatomical anatomy. My first time doing it was in Dallas, Texas, Waco, Texas, if I'm not mistaken. It was Frisco, Texas. I actually want to show you the photo of my first patient, and I feel so bad for him. I don't use a needle anymore. And remember I told you I had the vascular occlusion occur. I've only had one injury of all my patients. One injury. One injury of every patient ever. This patient still sees me. He's actually scheduled for a penile enhancement. He's supposed to do it 2 days ago, but he canceled. He's actually seen me multiple times. This happened last August. He's seen me multiple times since. He does adore me. It usually is gay men who do these, and he does do this thing called hole tox. I didn't know what hole tox was, okay? I learned it for him. Quite simple once you know anatomy, like at the level that I do. I mean, I am a bio major. That's how I'm becoming a doctor. Biology is my life. I love biology. It's my favorite topic. So I'm just finishing with my master's, and then in fall 2027 I start medical school, and I got to MCAT. I'm sure he's just there for, I get you. He's not. I mean, I've started to realize that people do find me. Okay, this red mark, I've got to get this off my face because it's making me look not as attractive as I am. But I know like people find me attractive. Like I've come to terms with it. Like the other day, I had 3 men standing in a line to talk to me while it was 2 a.m. in the morning, and I was just doing schoolwork, and there's 3 men in line trying to talk to me, like in a line, like waiting to talk to me. All don't know each other. It was very flattering. One was very disgusting the way he spoke about people. He was very, very vulgar. But it was very flattering, as I tell you. It was very flattering. Like, so yeah, I'm sure he's just there for a procedure. I get hit on all the time, every time I'm outside. Obviously, I don't have a bouffant on, but I'm just doing this to show my anatomical features, as I've literally told you. I do need to shave. And I don't look bad. I'm really even faced. Like, I really like try. I'm actually. I agree. Not this patient though. Not this one, but the other one. I just had a patient, or a potential patient, as I thought, right? Like this guy, he like, as I was telling you, like these men like were like in line to talk to me at McDonald's. It was 2 a.m. I just had gotten off studying for 7 hours straight. Okay, so I'm getting off. Okay, I'm gonna start injecting while we're talking. Okay, Cam, because I love talking to you. I think you're very, very. I actually adore talking to you, and I'm so glad you. You know what? When I got banned, I thought about you right away, and I was like, I really hope he finds me again. I was sad. So it's like really makes me happy that you found me again. Thank you for being so supportive and chatting with me and everything, because it keeps me going. You know, or else I'd be bored like doing this like live. I'm like, oh, oh my gosh, thank you. Thank you. That's so sweet of you. If it wasn't for the fillers, you should see. Do you want to see a photo of me? Okay, so I have 270 something fillers in my face. Just in my face, not my penis. In my face. I've had around like 40 syringes in my penis. 40 mLs. I would say. That's what started that thing at the McDonald's. This guy was like, this guy, the first one was like, it's always like Middle Easterns, okay? Because I'm Middle Eastern. They just somehow know I'm Middle Eastern, right? And he like comes up to me and they're like, he's like attracted to me, blah, blah, blah. It's like the same thing. It's like, whatever, okay? I was like, whatever. This other guy, he's like a capital mortgage capital. Oh, thank you so much. I really was depressed. Doing this, like the lives. Sorry, it's the lives that I like doing. I hate video editing. I hate doing all that type of stuff. It's really entertaining for me, right? But okay, here, do you want to see me at 21? Here's me at 21, okay? I had fillers, Kybella. I only had dermal fillers in the face, Botox, and Kybella, okay? I had dermal fillers and laser hair removal. This is me after my second Kybella treatment at 20. And then this is me when I was swollen. This is a June 20th. There's like comparing. Shit, can you see? Did you tell that's the same person? I'm less swollen now than in that photo. But yeah, the bursitis was gnarly, okay? Gnarly. It's like one, like, I probably have in my iCloud, right? Yeah. I've been doing a lot of work recently. Thank you. Here was me when I was swollen recently, March 7th, but I was beat up. And I put, so when you get microneedling done, you're not supposed to put makeup on. I put sunscreen and like tinted sunscreen on. Oh my god, I was breaking out for weeks after. Oh, it was awful. Such a dumb thing for me to do. Okay, I'm gonna get started on these treatments, okay, right now. Okay, here we go, Cam. God, I just want to show you like a bursitis video so bad. Okay. This was me draining it. I had to, okay, so every time you drain it, you risk the bursa pad thickening. You don't want a thickening of the bursa pad, okay, in the knee. You don't want it to thicken. So I was risking it thickening every time. So like this was like my 4th time doing it. So I had the first time, I only did it 1 time. I then reoccurred 6 months later, and it was so bad, dude. Like 3 times I had to do this, and it was like, it was awful. Like, oh, it was awful. But I know I have all the anesthetics. Like, I have everything because I'm like in the medical field. Like, I'm a medical professional. You know, like I'm very, very, very professional. I'm very, very, very intertwined in the medical field. And I like could not stop. I like, thank God I had lidocaine injection. Thank God I had lidocaine with epinephrine. Because if I didn't, I would not have been able to drain it. Now you have to go at a specific angle to even get it. I didn't even know what a bursa pad was, to be honest, before I started the bursitis journey I had. My friend took a video of me. Oh my god, okay, wait, here's me 18 to 26. So this is me when I didn't inject myself. I never had injected myself, but I had injections. I'd gone to Korea, I'd done training, okay, everything was done. I've done a lot of shit. Like, this is me 4 years into the career. So now I'm 3 years later right now. Here's what I look like. Ready? That was me with nothing, right? Wait. Nothing. There's me at 26 with fillers. What do you think? So I have like I had a non-surgical rhino, forehead filler, cheek. Obviously, look how big my face was, you know? I was also really sick at the time. I had fibromyalgia that was undiagnosed. And then here's me at like a really good picture of me. Like, this is me just a few months ago. This is my work. This is all my work. I only inject myself now. But I am a professional, like, so I don't recommend randos doing it. I call that the baby face, the Ayoob baby face transformation. I'm only red-eyed and stuff because I drew red marker under my eyes, okay? Okay, are you ready to get started with me? Yeah, this is me at 18. Oh, 18. That was me now, like a few months ago. 18. Yeah, huge difference, right? Here's what I really look like without all this, like, what I'm wearing today, but, like, I look cute, I think. I look really cute. Okay, here we go. Oh my god, thank you. My dad was bald at 26. I'm 29 now. My hair is really amazing, but I do lots of work to it. Like, I look awful right now. Oh my god. You know what? I'm about to be doing injections. I just had done 4 filler over a year. Yeah, this is side. Like last night. So I'm gonna finish all the work, okay? But my hair is really volume. Like, I did not have hair like this growing up. But look, I don't even have like a. You can barely see my like roots. I was so scared of losing my hair. Like really, like, and I like and like actually growing hair. Like, I do use minoxidil and dutasteride. Not orally. I use So you, if you're gonna, do you have hair? Do you have hair issues or no? So my dad was fully bald at 26. I'm 29. So my fear was going bald. You know, I used a compounded like product, and I'm gonna start doing the procedure now. Okay, so I'm gonna show everything that I'm gonna do. Okay. I need to shave. So no, there's no point in shaving when I'm about to like annihilate my face. Okay, so here we go, y'all. Okay, so I'm actually gonna get hyaluronidase ready. This area is bothering me. And the hairline's on point because I've been taking care of it. And I also microneedle my scalp too. My mentor who had taught me all this stuff, who taught me in aesthetics, like she taught me like everything. Okay, she taught me like everything. Like everything. Okay, she taught me so much. Yeah, you should definitely try minoxidil. Okay, so this is the thing. You know they say Rogaine doesn't. Damn, do I just talk about science all day? I'm so sorry if I'm boring you, Cam. Okay, how old are you? Because your name's Cam Mike 360, so there's no there's no way I can guess how old you are with that info. I don't know. I feel like right here just needs to like get less bulky-ish. Sorry to ask how old you are, but 360 is like an angle, you know, geometrical angle, which I use geometry every day at work. I think I need a hyaluronidase there. Once I do, everything will like start to like come into play and look better. And then I do. This is something we did. We definitely need to go here. Are you 27? And you know, did your family have hair loss? Okay, do you know what matters? I met my grandpa one time, my mom's dad, okay? One time at Chili's when I was 15. He's a crackhead, and he had a full head of hair. My grandpa was very successful on my dad's side, and my dad are both they're successful, but very stressed out, I would say. Doesn't have anything to do with hair loss, so it really doesn't. Isn't that crazy? Like, it really doesn't. It has to do with, you know, has to do with, like, is DHT sitting on your scalp? It's active from this thing called DHT. So if you like get rid of the DHT, like by using the proper shampoos and stuff, like Nizoral, for example, it's ketoconazole. You can buy it at the store, over the counter. I can send you a $50 gift card to this thing called Muesli. They use compounding. Now their ingredients are, you can't get any better. Like, for real, like, they're off the chain. Okay, dude, like, they're off the chain. Amazing, amazing, amazing products. I cannot recommend them more. Oh, I'm drawing red because I need to dissolve. So let me do this, like, correctly. Red's for dissolving, okay? Red's not for, I don't know what I'm, like, the artistic vision right now is. Red's for dissolving. Blue is for addition. Oh my god, thank you. Because I can go, I love hair restoration. Like, I can go on and on about it. So this is what you want. This is how hair loss works. For men and women, androgenic alopecia. There's also other types, alopecia areata. That's when your immune system attacks your hair cells and you lose your eyelashes, your eyebrows, and your hair. Everywhere. Your pubic hair, your scalp hair. This fixed it. Blue. This can stay. This needs to go. So the forehead's very anatomically dangerous. It's actually one of the most dangerous areas to inject. I do it a lot. It's one of my most common areas I inject. People come to me for it. So, okay, let me go back to the hair. Let me just talk about hair while I do this, okay? Remember, let's all remember, whoever's in here, red's for dissolving, blue's for adding, okay? Okay, so for hair. So androgenic alopecia, that is called androgenic alopecia. It means that you have hair that needs to is follicles that are dying off. And the reason they're dying off is because they are being... You're not at all. I love you being in here. Thank you, Kim Mike. It's really keeping it going. I really appreciate that. I actually love you. Like, I really do love you. I really love you as a, what do I call you? Not my top fan, but you are, I feel like you are like a very, I love chatting with you. It doesn't bother me at all. Thank you so much. I'm not a celebrity. I'm gonna be a doctor. So, I'm gonna get my medical degree. So I'm not gonna, I'm not no fan. And oh, thank you. No, for real. Like, I adore you. I really, really, really love like you coming in. When you came in today, it made my day. I never thought I'd see you again. So that means the world to me. Okay. Okay. So here's how androgenic alopecia works, real quick. Ready? Okay. So you start losing your hair. Thank you. Thank you. I look horrible with this cap on, but when I look healed, because you're about to see me get fucked up. Your butt doesn't make it fucked up, okay? But once I look after that heals, I'll look fabulous, I promise. That's so sweet of you. Thank you. Okay, so androgenic alopecia, here we go. So androgenic alopecia happens because of the thing called dihydrotestosterone, dihydrotestosterone, and it actually sits on your hair follicles, and it shrinks the hair follicles to where they don't get blood supply anymore and they die. Okay, so Rogaine minoxidil brings blood supply back. It's called a vasodilator, which is also in Viagra, Cialis. Those are also vasodilators. Trimex, I don't know if you've heard of it. I have a few patients when I do the penile augmentation, and they have a hell of fibrosis because they did Trimex before they have intercourse, and it's really awful to work with, okay? Like, it's actually, it grosses me out, honestly. I shouldn't say that, but it does. It grosses me out because it's so fibrotic. I have to, like, do you know what subcision is? It's when you go under scar tissue. It's when you break scar tissue apart. So I'm having to, it's awful. It's awful. Every time I'm like cringing while doing it. I have a video of me doing a patient recently who has not paid, didn't pay me. I've known him for years. He's in a very high profile case with my ex who I was dating. This is years ago, 2023. I was just dating him between the guy that was, I don't have a boyfriend or anything. I'm not dating anyone, but I'm just saying, like, I dated this guy, and he's a really, really well-known guy. He got murdered, stabbed to death in SF. Oh, thank you, right? And this guy is a well-known DD. You know what I mean by that? Drug dealer. He's not my drug dealer. He wasn't a drug dealer, man. He's not my drug. Regardless, I did his penile enhancement, right? And I've known him for years, and he's a part of the trial. I wasn't a part of the trial, thank God. Because it was awful for me to go through, okay? And I had to witness, like, someone die, and, like, who I cared about, and they paid for lots of my schooling. Like, I don't have any student debt currently. I will soon, because I'm gonna, when I get to medical school, I just am getting through pre-med, and then I'll be in medical. But I've done 7 years of clinical work, all this stuff, right? So it's like, I've done a lot of shit. And, like, I have 127 certifications. I've been trained in 204 procedures, surgical and non-surgical. So I've done a lot of my career, right? And this guy, if you Google it, you can kind of find out who I'm talking about. But I just try not to make it, like, well known, okay? So anyway, so I was dating this guy, and he paid for all my stuff. He paid for, like, when I went to create my internship. Like, he really helped me so much. Like, I'm so grateful for him. If it wasn't for him, I wouldn't have been able to achieve where I've gone in my career today. So thank you to him and my grandma. Those two, and my mom. Those three helped me so much get to where I am today. So moving on from the sadness. This man, I did his penile treatment for him, and he owes me $2,000 from it. Oh, by the way, I only charged him what it costs to buy the materials because I had known him so long, and we've been through something kind of traumatic. I just thought, like, oh, I don't know, like, I trusted him. You know, I really did trust him because I never not paid him when it involved, like, things that he does, like, peptides. He sells peptides and stuff. He has, like, a peptide company. Anyway, I never not paid him. But anyway, so he said, okay, when he did the procedure, he's like, okay, I'll pay you in June. It was January. He signed a contract. He still doesn't pay me. I'm going to actually take him to small claims court. I agree. They were the best. If it wasn't for them, especially my grandma, oh my God. That woman gave me, like, her and this woman named Alice Tung. Alice Tung, family nurse practitioner. That's who gave me my career. Love that woman. So my mom, grandma, Rob, the man who got stabbed, If you Google it, you can find out what I'm talking about. And then my grandma, and then my mom. So like they like really gave me everything I needed to be successful, and I'm really grateful for them because see, it's like painful for me to even talk about. It's like it was really traumatic because it actually involved. Oh, I want to tell you so bad, Kim Michael's story. Basically, I became friends with a plastic surgeon who's really well known here. He started mentoring me as well. I became friends with his wife. She was having an affair with this man. It's an awful story. I should not even talk any further, okay? My boyfriend at the time was friends with the guy that she was having the affair with, aka the guy that didn't pay me. Right? Which that was years later, right? It's like 2023. The murder happened April 2nd or April 1st, 2023. It happened. So now we're in current times, right? And so he did like the murder like changed my life because I couldn't get what the murder like just really was like scary and eye-opening. It was really scary, okay? Because like my friend called me, who I thought was my friend, and her brother ended up murdering my boyfriend. And her husband's a plastic surgeon. I really should stop talking. It's a really well-known case here in SF. I think the trial just ended. I wasn't a part of it. It was really awful. Anyway, he paid for so much. I mean, like, over $500,000 in education. That's how I got so far. That's how I got into my med program that I got into. And May 11th, I got acceptance. The amount of clinical hours and the amount of certificates I had was astronomical. They said that was so impressive. So it means so much to me because I've done so much work to get to where I am in this field. And it wasn't just like him paying for it. I just wouldn't have been able to get to this point if it wasn't for him. And he like was he was quite really, he was really owns a really big app. Yeah, you probably Googled it and you're probably getting like all the details. It was a pretty bad situation. I don't know why I brought this up, and I'm so sorry. I should not have brought it up. Okay, so now we're back on. Okay, everyone. So so where I drew red is where I feel I need hyaluronidase, okay? Not in the red marks that have blue over it. The red. In America, we have a product. Again, I'm trilingual. He was real one, and then I wish I would tell you if we had a personal like one-on-one. I would tell you. I'll tell you everything. Maybe one day we can talk. If we could talk about everything, I would totally tell you all the deets. It's really sad. So I'm fine. I'm not upset. I promise. Okay, ready? So I'm gonna use a product called Hyaluronidase. Hyaluronidase is, I didn't even tell you about androgenic alopecia, but we're going to talk about it because I'm going to do my hair, okay? So I'm going to microneedle my hair. And I'll tell you why I do that too. Okay. So, everyone, I'm going to dissolve some filler just in the middle part of my forehead. And then around it, I'm going to... And then around the filler that I dissolve, I will be adding in. I will be doing. I think I might do Letybo first, Okay, I'm cleansing my hands. I have gloving, obviously I have gloving. But I'm cleansing my hands first, okay? I'm gonna show you guys. I would love if you did that. Oh my gosh, and I would, do you know how big of a discount I'll give you? The biggest discount ever, okay? I'll do your work for free. That's how great you've been to me. I appreciate you. Okay, so, I drew on my face. The blue means good, red means bad. So I'm gonna target these areas. So this enzyme, it's called hyaluronidase. In America, we only have two versions, Vitrace and Hylenex. They both, oh, and also they somehow, it's the allergic reactions can occur because it occurs in venom, but there's a lot of different types of things. Like I think the specific one, like some come from testicular, the balls from cows, bulls, from bulls. Well, the testicles from bulls. The ovarian cells of hamsters. Hyaluronidase comes from these animals. And there's also recombinant human hyaluronidase. Now, hyaluronidase occurs in your bloodstream. So your blood carries hyaluronidase, okay? And you naturally have hyaluronic acid in your body. Now, there's some theories now, and I actually agree with these theories. I was watching a lecture earlier today, actually. Sorry, yesterday, I mean. And this theory was hyaluronic acid isn't moisturizing at all, and the mechanism of action that causes that is from a reaction with cat. You know, like cat ions and ions. There's a negative and positive charge. Well, do you know like the sodium version? You know, usually when you look at hyaluronic acid products, it'll say a sodium version. Okay. So, and when I do my hyaluronidase reconstitution, so here's the thing. I am trilingual, as I've been saying. I find the Hylenex and Vitrace 150 units to be an insult to patients and providers. I think it is a money-hungry grab. Okay, I think it is money-hungry. I think it is lame. That's what they put it in. Like that's what they sell it in is these one. Oh, by the way, whenever you want to do this, okay? So I'm actually gonna leave it on and put gloving on now. And I just find it insulting that they do it in 150. That's just big pharma in America, raking in money, okay? Because in Korea, for example, and actually in Europe, specifically Ireland, I know Dr. Patrick Tracy, who is a colleague of mine. He actually knows me, follows me on Instagram. If you guys don't know who he was Michael Jackson's, one of Michael Jackson's plastic surgeon provided, dermalogic. Well, he like went to him to, he was like, did one of the first rhinoplasties ever, using Restylane on Michael Jackson. He also dissolved Michael Jackson's fillers before he met the Queen of England. So he came to Ireland and met Dr. Tracy has books on it. You can put hand sanitizer over gloves. I like to do that. Sometimes when they're exam gloves, I just like to do it. Sometimes it kind of gross me out sometimes because I just like feel, I love sterile gloving. I have sterile gloving, but those are safe for the patients. So we're gonna do some hyaluronidase dissolving. Are you guys excited? Because I am. So I like to reconstitute with lidocaine. Now here's the thing about hyaluronidase. It's very unstable. So hey, when you use it, toss it. Where you don't use, toss it. Just make a new vial. But the thing about America is that they are so expensive. I'm not mistaken. Let me go actually, since we're on this chat right now, Sorry, we're on a live stream right now. Let me just show you guys what I'm talking about. And hyaluronic acid is really abundant within the eyes, the kneecap. That's why there's intra-articular injections of hyaluronic acid that they do into the knee to help cushion the cartilage and the bone. Like it prevents degradation of the cartilage because it actually is preventing. It's helping prevent like the degradation by the friction on the bone. On the cartilage with the bone. It's awful for your knee, you know. So they made a injectable Monovis where they inject it intra-articularly, and it lasts around 2 to 3 years. And they also have them for the eye. Like when I'm buying pharmaceutical supplies for work, for the business, sometimes I come across ophthalmic. I love that. We'll go on a date. I love it. Let's do it. They come up with ophthalmic products like Hyaluron, and they actually inject it behind the eye, and it gives a hydration. Not only that, it does push the eye. It helps with the surgical procedure. Okay. So right now I have lidocaine 2%, my favorite. This is my favorite brand. It's by Hospira. His name is Dr. Patrick Tracy. Dr. Patrick Treacy. If you follow me on Instagram, by chance, the House Called Beauty, or the do you follow the House Called Beauty, or do you follow the Injector Tanner? He follows me on there. We know each other. I think that's pretty cool. He's one of the pioneers of medical aesthetics, if not the. Besides the two ophthalmologists who made Botox, who created like Botox, botulinum toxin, to be what it is today. They're also pioneers, but Dr. Patrick Tracy is a pioneer, girl. Like, he is iconic. Okay, so, as I was saying, it's highway robbery here in America. So, $375 it costs to buy 4 vials of Hyaluronidase, which has to be refrigerated, by the way, the entire time that it's in your possession prior to usal. It must be under strict temperature control. Okay? I just made 1,500 units of hyaluronidase, okay? So $375 for 4 vials. That's 600 units of hyaluronidase. How much do you think it costs in Korea or the UK? But Korea, let's just do Korea for example. $375 for 600 units in America. When I tell you the equivalent, your jaw's gonna drop. I would say it's around $35 to $40, $45. A really famous brand is called Lipo. I actually have a vial right here. Lipo. This is a 1,500 unit vial. So every 1 ml of hyaluronidase, if you do it correct, if you do it in this reconstitution, so this is a 1-to-1, right? That's actually a 1-to-10. That's a 1-to-1 because the manufacturer says to do it like this. But the 1-to-10, right? It's actually this. So you do it 1 vial to 10 mLs of solution, reconstitution solution. Now, whatever you use to reconstitute, that's up to you, honey. That ain't up to me. That's up to you as the provider. So, like when I was there, I was taught about all this from my mentor, and I thought it was just really interesting and amazing. You know, how expensive American pharmaceuticals are, and how it's highway robbery basically. And so let's do the math real quick. 600 units, $375, right? A 10 box of 1,500 units. How many units is that? It's 15,000 units for $45. Let's just say 45 at the highest. What would that cost in America? What's 15,000? Well, that is 15,000 divided by 600 is 25. Oh, it's 25. Wow, okay, so you need 25 boxes of Hyaluronidase to reach that box I'm talking about. And guess what that would cost? If you $375, right? So you need $9,375. $9,375 versus 30 to 45 bucks. I swear it was set 25 when we bought it at the clinic. Oh my gosh, I love perfumes and stuff. Okay, so that's my favorite topic. That's one of my favorite topics. Okay. I love that. Okay, ready? Oh my god, I love Victoria's Secret. I know you're probably okay, so Victoria's Secret has this stuff. Okay, my favorite scent of all time. Okay. Oh, this is called Numbstat, by the way. It's a numbing wipe. It's benzocaine, menthol. Don't get it near the eyes. But it's benzocaine, menthol, and it has benzyl alcohol, isopropyl alcohol in it. So benzocaine, isopropyl alcohol, and menthol. My favorite. Okay, so I love scents. Okay, I actually have them right next to me right now. I'll show you my favorite scents. My two favorite scents of all time, and I mean I wear these every time I go to work. Okay, sometimes I switch them off. Sometimes I wear them together. But right after I get out of the shower, I even spray my hairbrush in it, and I use it in my hair while I do a blowout. Okay, so it's from Victoria's Secret. It's called their Bear Suede. They're Bear Suede, right? It's not Magnolia. Well, let me check. Bear Suede Magnolia Victoria's Secret. Okay, so sorry, not Bear Magnolia. It's called Bear, and it's called Suede Vanilla. So that's my favorite one of all time, okay? Second to that, they're vanilla sprays. They have vanilla body mist. And I freaking love their body mist. Like, I'm obsessed. So, like, I literally go between these. So, I use, oh God, I love Victoria's Secret so much. I have no money right now. Like, I'm the brokest I've ever been. I'm having to pay for my school. My college. I'm just past getting my I'm finishing my master's right now in biology. I've gotten all this education in this field of work, and now I'm going to go to med school. I'm so excited. That starts fall 2027. Now, the reason I bring that up is because I'm the brokest I've ever been. I love Victoria's Secret, okay? I love their perfume. So, Bear Suede Vanilla perfume, #1. I'm not finished, though. Bear Suede Vanilla with the body fragrance. They have these body sprays. And they're usually on sale, okay? And it is God, I wish I could just send this to you and show you. They have like all these new ones that are vanilla. Oh my god, they have vanilla mousse and all. Okay. My classic ones, Bear Suede Vanilla. Okay, next. the Vanilla Shimmer Body Mist, okay, and the lotion, okay. Vanilla Shimmer Body, Bare Vanilla, so literally, Bare Suede Vanilla, which is a perfume. It comes in a perfume bottle and a body mist. It has its own body mist, and it has its own lotion, okay? Those are my favorites. Along with the Bare Vanilla Fragrance Mist, which are usually on sale, like they are right now. $8 each when you buy 5 or more. Then they have Bare Vanilla Shimmer Fragrance Lotion I love. So I like the shimmer one, okay, over the normal one. So definitely like the shimmer one, okay? So Bare Vanilla Shimmer, Bare Vanilla Fragrance Body Mist. If you can't get the shimmer, then I get the non-shimmer one. Then the perfume, because the perfume is the Bare Suede and the Bare Suede Body Mist and the Bare Suede Lotion. Then the last one, okay? These are my scents. These are my iconic scents. These are the scents I literally live for, okay? These are the ones I wear 24/7. So besides the vanilla, those 5 vanillas, remember, they're 2 different types. So Bare Vanilla is like their body mist and lotion. The other one's body mist, lotion, and a perfume bottle. And I love that shit, okay? And then the next one is the Sugar Velour, okay? Sugar Floor. It's called Tease Sugar Floor. And I also love Tease, but T is Victoria's Secret Tease Sugar Fleur. That's my other favorite scent of the world. Like, I love that scent. It's so amazing. It comes in a perfume bottle, a lotion, and a body mist. Just like the Bare Suede. So, like, they're both, like, coming off. They're, like, a subdivision of, like, their main scent. Like, it's Tease Sugar Floor. There's, like, a Tease. The Tease one is also really good, okay? So I like Tease. I like Tease Sugar. But my top will go like this. Bare Suede and the accompanying mist, lotion, and perfume bottle. The second to that is the damn, I would say the Sugar Floor, the whole thing, like the whole kit, like the perfume bottle, the body mist, and the body lotion as well. Then the Bare Vanilla, which is just a body mist and a lotion. And then Tease, which is a perfume and a body mist and a body mist and a lotion. Those are my favorite things ever. I like have tried all of them. I've tried everything, like Gucci perfume. My ex had bought me one, and it makes me cry, like, smelling it, okay? So but never, like, was my favorite. Like, this is my favorite, like, Victoria's Secret, and when they have sales, I, like, I just wish I had money like I used to. I have no money at all. Like, when I used to have money, I just would love to go shopping at Victoria's Secret and just get my stuff. And they also have this angel freaking cake. Let me check if they still have it. They have this angel cake, like, yes, angel cake and cream. Is it still there? Whipped milk and sugar. No. Is it gone? Oh, and I just love their Bare Vanilla. Sorry. They also have vanilla body lotion I love. Their vanilla hair and body mist I love. It's on sale right now. Oh my god, I want it so bad. It's literally half off, 50% off. And their vanilla body oil. It's in the pink section. Pink's like a subdivision of Victoria's Secret. So I like the vanilla body lotion, the vanilla hair and body mist I love, and the vanilla body oil I love. And then those also have like a really good vanilla scent. But they have this angel cake freaking spray. It was amazing. But now they have one called whipped sugar and milk. Does this smell like the one? They said it smells great. Okay, well, anyway, those are my favorites. I hope that made sense. I'm so sorry for that. I just love those scents. They're so amazing. I'm so sorry. I know I just went off crazy. I wish I just love having money and going shopping. Like I miss having no money. I have no money right now because I have to catch up on my rent and stuff. I'm like, why am I telling this all on YouTube? This is like so embarrassing. I need to stop. Okay, I just did that, right? I need to stop talking about my personal life on YouTube to strangers. You're not a stranger though. Sorry, Cameron. I love scents. Like I can't stand when a girl or guy smells bad. I can't stand it. It drives me crazy. It's very unattractive. And I deal with patients like, some patients like come to us and they think like they don't need to be like clean or showered. Especially when it came down to lasers. Like when I had lasers, like when I was doing lasers a lot, that was something I noticed. Also, I noticed like the armpit one. Oh my god, look at my spray. I don't have vitiligo, I swear. When it came down to the when it came down to those damn lasers, people really were ballsy with like not showering. Isn't that crazy? Here's my first injections, everyone. This is hyaluronidase in a very specific spot. Let me like really mark it one more time. Okay. I think I'm doing the right decision. Yeah, I am. I love their stuff too. Like they have really awesome like clothes. Like I know like I don't wear like the too girly stuff, but they have like awesome shorts and like I actually wear their underwear, so there's some awesome stuff. Here's my first injections, everyone. So here we go. Wait, can I like there's something somehow I was able to do it earlier. Wait. It says I could like do it. Like I could like zoom in or something. But that's not. It says edit. Let me see what edit means. Nope. Don't want to edit that. Mess with that. Here we go. Ready, everyone? 1, 2, 3. It's the Ivory Consuls lidocaine. This is 1,500 units measured in 5 mLs of fluid. What about you? What's your favorite fragrance, Cam Mike? Do you have a favorite? Oh my god, it like actually flashed back. Do you see that? Into the syringe. It's safe because it wasn't epinephrine. Actually, nothing's safe if you're intravascularly injecting it unless you're doing an IV. So that was a mistake on my end to say that. So I'm sorry. Since this was done with lidocaine, it does numb the area pretty fast. Okay, let me get one more thing real quick. Oh. There's the tea body, the tea sugar velour. Tea sugar, but here's the magnolia. I love this stuff. It's my signature. I get a lot of compliments at work about it. See how I did clean my hair after touching it. Ow. Okay, I got a gusher. Go, 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 get it, get it, get it. Taste the bleed on your face. I could feel it gonna gush. Look. Do you like these lives better? How it's like set up better, Mike? I do. It is an expensive hobby. I've never heard about that one. Where's it from? Who's the company? I love that men who are into fragrances, okay? It's attractive. It's very attractive. Ooh, that's awesome. I love that for you. That's the best. I got a compliment with that sugar floor from this security guard girl. It was a girl. But she's like, you smell so damn good. Like, what are you wearing? Like, oh my god, you smell amazing. So I gave her the whole rundown of what I did. So when it comes down to hyaluronidase, by the way, everyone, it's only you and I, Cam, isn't it? How many viewers have I had? I miss when I was getting like, remember when I used to get like 75,000, 100,000? Oh, okay, I'm Middle Eastern. I'm Lebanese. I love those fragrances. Do you know like the really sticky? They're like really goopy. They're really like thick. Do you know those ones? Do you know like the ones I'm talking about? Like they're like really like thick ones. I'm gonna look into it. I'm gonna look into it. I just screenshotted what you said. 4 views. That's it. Is it goop? Is it one of those like really thick Middle Eastern ones or what? I've seen them like they're like really thick. I've always wanted to try them. I bet it was kind of expensive, the one that you used. Am I right? If I had $200 to spend at Victoria's Secret, I could buy so much freaking stuff. Oh, I love that place. I know it's for girls, but I'm not transgender or anything. But God, they have the best stuff, and I even like their boy shorts. They look really good on me. No way. 35 bucks for that? And it gave a girl googly eyes? That's cheaper than the Victoria's Secret one. Ugh. But I gotta try it. That smells yummy. I love guys that are into fragrances. I love guys who are into hygiene, like smelling good, like taking care of themselves. It's really attractive trait. Really, it is like really attractive. Girls also think so. So hyaluronidase stops working after around 3 hours, and it's true. It totally does not work after it. I'm definitely gonna check them out. I've actually screenshotted what you said 4 times now. Screenshot the last time, because this one brings it all up. I'm gonna definitely check. I'm definitely gonna check it out. Yeah, there we go. I'm still gonna check it out. Trust me. Ooh, is it manly smell? What kind of smell is it? What's your favorite fragrance right now? Like of all time? Is it that one? And you can usually see the hyaluronidase working immediately. That's crazy. That's $35. $35. I'm just shocked. I'm shocked. That's $35. Rasaya, Hawaii, Hawasi, Renya. Oh, I gotta check it out. Yeah, no, I love fragrance. Like, I'm a fragrance obsessed. It's my best friend's birthday today. We grew up together. I've actually got to get, I'm gonna actually have to cut this. No, I'm not gonna cut off right now or anything, but I'm gonna have to cut this live short so I can go see my bestie for her birthday. We've been friends since we were 12, 13 years old. And we've been like planning we've been planning, I've been trying to like, her and I are actually gonna hang out for her birthday. I'm excited. I can't wait to see her. Happy birthday, Jackie. Her birthday's tomorrow, but I'm super excited for her birthday. You go always, birthdays are special. Do you celebrate with your friends too? Love my bestie. I do. I actually love her. I love her so much. So I guess I'm like gonna cut. Like I should maybe just do like my knee filler. I gotta do like keep on track. Yes. Happy birthday to her. We both are turning 29 years old. I can't believe we've been friends for 16 years, 17 years. Isn't that crazy? I think that's crazy. I just find that crazy. I'm just like, wow. I don't want to be old. I hope I don't look. I know I don't look 29. That's for damn sure. That's for sure, baby. I won't be swollen too much before when I see her. It's 8:30. It's okay. Where you live, it's 11:35. Where I'm at, it's 8:35. So like, if I do this like right now, not only I won't be too swollen when I see her. Because this is just dissolving. Like, I just noticed like I just needed it. Like it just was overdone. I'm so excited to see her. She just like sent me like what we're gonna do something fun today, so I'm excited to do that with her. Mm-hmm. I sent her a link to my live. I doubt she'll even come in, but I am actually. Is it cool if I come over like right now? Like I will like cut this short. I will like get my shit together and I'll come over right now. Are you cool with that? I can just get ready there. Is that cool? Sorry, I'm writing a text to voice chat. Today's gonna be a great day. What are you doing today, Cam Mike? Anything special? Anything going on in New York? Oh my gosh, so I used to live on East 45th and 2nd Avenue. Did you see what was going on there with like the building collapsing? I was 19 years old when I lived there. That shit's still going on. Oops, I hit an artery. It's gonna look really good because it'll all look even after this. I know it. Oh my god. That was crazy too. Apparently they've been married for years though. But that shit was wild. Did they get arrested? How'd they even get away with that? How'd they get away with that? I'm gonna come over now. I'm literally gonna like get my shit because I have it still packed from last night, and I'm just gonna come over. I'll text you when I leave. I should leave by 9:30, okay? And I'll be on my way. Okay, this is gonna look so much better. I'll look good for my friend's party, my friend's birthday. They definitely should have got arrested. They had a documentary I heard on like Netflix or some shit. I would never. Would you climb that high, Cam Mike? Would you ever climb that high? Because that shit is scary to me. I'm not afraid of heights, but that shit's wild. Like, that's like crazy person type of shit. Oh my god. Do you want to see what it looks like? I think I'm gonna look more attractive without the bulging. I just feel like it was like over the top. What about the Taylor Swift wedding? What do you think of that? Ah, oh shit. So when that happens, you really got to press. You gotta like compress the artery. I definitely just hit the supratrochlear artery. I definitely just hit the supratrochlear. So imagine like I was injecting filler and hit that. You know, your blood actually carries hyaluronidase in it. So like for the penile and fillers, like the penile tissue versus the glands, like the glands actually doesn't fill with blood because it doesn't have the corpus. It's like the spongium. It's like the spongy like erectile tissue on each side of the penis that makes it erect. The glands does not have it, so it actually degrades like 0. It's like it's really tiny compared to the actual penile shaft, which degrades really fast. Sorry, it degrades faster, but it doesn't mean it degrades completely or all the way, you know, it just like, it does degrade. I do so many penile enhancements. I love doing it. They're selling the wedding trash. That's crazy. My best friend likes Taylor Swift, actually. And surprising because she's not a pop girl. Okay, I just like did a lot. I hope it doesn't look bad. I'll be upset. It's my bestie's birthday. So, like, look, I'm not even going to bruise. Like, I can tell. So that's cool. Maybe I should do my Botox. The blue was like, maybe I should wait for the swelling to go down before I add any more filler. I'm going to change my gloves. Oh my god, look what I had in there. These were unused needles, by the way. Look what I had in this one. Just sitting in there. I was about to drink the juice. Oh my god, come here, bitch. Could you imagine swallowing a needle? Like a whole ass. That was in it. Okay. I'm going to my friend's birthday. It's my friend's 29th birthday. My bestie, my lifelong BF, you know? So I'm actually going to speed run Botox right now. Are you guys ready for it? I think I can do this in under 15 minutes, okay? Are you guys ready? And then I'm going to leave by 9:30. I think I can do it. What do you guys think? Do you think I'm being too optimistic, or do you think I can do it? Because I think I can do it. Oh. This is alcohol. I'm just cleaning it so I don't get infection. It'll dissolve. The hyaluronidase stops working after 3 hours. I think I can do it. What do you think? So I actually had a problem. Okay, do you guys want to hear about this? I actually had a problem. My Botox, I had bought a special fridge, right, for it. See, being a business owner, working in a business and being like a part of like this like real big part of the staff, like beyond management, like CEO, CFO, you really like engage with these problems that you wouldn't expect to have, you know? And this is one of them. So this problem occurred, right? And here's the problem. I had this special fridge, I bought it. It's supposed to be for insulin. So again, if this is for an insulin, could you imagine your insulin going bad? So I like had a patient like say, "Oh, nothing occurred," and I was like, "Oh my god, okay, like I will like, I'll do it for free. Like, let me see you." And she never responded back to me. Unfortunately, that's sad. You know, like I don't want to lose a patient. You know. Okay, I'm gonna speed run this. Okay, I'm gonna use Letybo today. Speed run it. Yeah, I think this will look better with the dissolved. I think like that was the right decision. I can already see like the difference occurring. I just don't want to be too much dissolved. Oh my god, it actually looks so much better. Wait. Perfect. Much better. This side was the perfect side before. Wait. Yeah, that's so much better because it was overdone. Oh my god, thank you. Okay, Cam, are you ready to watch me do it? Because I'm ready. Okay, here we go. Okay, first, let's mark. Are you guys ready? There's 2 people here, so I'm gonna just do this real quick, and then I'll go to my friends. 2 lives in Oakland. So I gotta like... Okay. Okay, I'm ready too. Ready? Okay, let's mark it first. This is how I get ready for a patient's Botox. Are you guys ready? 1, 2, 3. Here we go. I go, make the most angriest face like you're having the worst day ever. Since there's no hyaluronic acid being involved. Oh, thank you. Oh, Oakland's fine. Don't worry. Oh my god, she lives in a nice park. There's this park called Piedmont and Rockridge are very nice areas. Okay. So this is like how I do it. So I like say, make the angriest face like you're having the worst day. Awesome. I draw this line because that's not where you want to. You don't want to inject right here. Okay, that's a no-go. Okay. And then I go raise your forehead. And if they can afford it, I do the full kabang. Like I'm gonna do to myself. This is where you draw these cat ears. Okay? So you don't want to drop this. And they should be like evenly. I think they're pretty even. I thought the camera was right here. Okay. And then I will do MesoTox. I'm gonna have to come back on. I'm probably gonna do it at our house later. I'm gonna do like I'm gonna do their arms, and I probably will do after we go to like this thing that we have planned. She just texted me about it and she's like, let's go. And I'm like, okay, let's do it. So I'm actually gonna just get ready at our place. And then I go wink. And look, the Botox didn't even work on me. So that says something, okay? Wow. Look at the wrinkling. And I just did all my stuff too. Like, I just had done my stuff. Then I'd like to do the Barbie eye, which is, I say, patient, look right at me. There we go. That's the Barbie eye. This one I like to do, but it's so painful. I like to do the nose. This is the nasalis. This is not what I was talking about. But the nose mean like right here. Right here. That like stops you from flaring your nose. And it can slim down the nose. But you don't want to overdo it, because I did overdo it before, and me and my best friend, same side effect at the same time. Actually, we were like, it was awful. Okay. Chin. So with the chin, you have superficial and you have deep mentalis muscles. So you want to actually do both. You want to target both. There you go, like this. That's how I do that. That's that one. Now I do the Radiesse, which actually comes 1 centimeter-ish, 1 millimeter below the wet lip. Sorry, I'm blocking my face as I'm doing this. Oh my gosh. We do 3 marks. Do one right here in the buccinator. In the temporalis. I like to bite on some things, so it's like and that's how I do the lower, that's how I do the full face. So that's how I target the full face. You can also do MesoTox, which I will end up doing. Okay, it's 9 o'clock, so I got like minimal time. This is a platysma bands. I'm also going to do those. You can cause issues with eating and swallowing if you do this wrong. Damn, yeah, that tox that we were carrying did not work. That's crazy. I offered a refund to the patients. None of them. It's like I lost patience because of it. It's like, it wasn't my fault. And I want like I contacted the first few of them. No avail. It was a portable insulin fridge. This is how we do it at the House Club Beauty, okay? Now we're gonna speed run this motherfucker. Okay, sorry for swearing. Are you guys ready? Oh, I definitely will. Oh my god, thank you. I literally screenshot what you tell me. Thank you. You're the best. You can, Mike. Thank you. You should try out you should go check out the Victoria's Secret shit, because that, sorry, you should try out the Victoria's Secret for free, because that shit is the best. Okay. You can add lidocaine to Botox, right? Like, duh. Okay. We don't got much. Okay, here we go, y'all. Okay, 1. So this is my full neck and face. We're not done yet, so we're gonna have to do a part 2, okay? But this is gonna be the full face and neck. And master, the buccinator. This is actually I'm actually publishing a medical study of my own in the medical journal, peer-reviewed medical journal. Isn't that cool? I think that's iconic. I made up my own technique. I'm not going to tell exactly what it is. I don't want to get spoiled. But I'm pretty sure I'm the first one to do this, and I checked in English and Korean and Chinese. So I'm pretty sure I'm the first one. So wish me luck, everyone. This is Letybo. Letybo is very popular. Sorry, it's actually not very popular, and it is the best toxin around. It's better than Daxxify. And it's FDA freaking approved. Okay, here we go, y'all. I'm going to do it with some Lido. Just because it's so... Yeah, I think I'm going to reconstitute with Lido because I'm going to use it really fast. Let me just check this. I got to go after this. I can do this really fast. I know it, okay? Hey, you can reconstitute Botox with lidocaine, right? Sorry, Letybo, Letybo. I'm texting a friend. I know, like, I've done it before. Okay, this is, so this is a 200 vial. Thank you, Cam Mike. That's so sweet of you. Thank you. I try to be as pretty as possible. That's so sweet of you. Thank you. Oop, and it sucked it right up. But I guess, like, it could make... That's so sweet of you. Thank you. It makes my... Oh, that was so nice of you. Thank you. Oh my God. I really appreciate it. Well, it says that it might not be worth doing it with lidocaine, but this is what I'm going to say. I'm going to do it. So I need 1.25 left. So 1.5, 1.5, 1, 2, 3. Okay, we're done. Okay, ready? One, two, three. So then you just like, you don't want to like mix it, you know? But you do like, you can go like this. And then let me get my my 1 ml syringes. I gotta be fast about this, so I gotta go to my bestie for her birthday. Okay. I'm gonna like time it, okay? I just did this in 16 minutes. I just like reconstituted it, so let's keep it going. Ah, so fast. I can do this. I know it. So this is Letybo, my favorite toxin ever. I used it in Korea as Botulax. Oh, shoot. Ooh, I almost cut my hand. Straight up with the glass. I hate foil. I hate the foil. I hate it. Okay. But there we go. Okay, so I need just like, I just need the freaking 1 mLers. I need the 1 mLers. Where are you at, 1 mLers? 1 mLers, where you at? Where you at, my one? Come on, my runners. Where you at, my love? You know, where are my oneers? Where's my oneers? Where's my oneers? Come on, my oneies. Come on, my oneers. Okay, so like you really want to be like, oh, it will not be my last live. I'm gonna be very on top of it. I really love how supportive. Cam, Mike, you made my day. You really are so supportive of me. It means so much to me. I mean, it's really the best. You're like really the best. Thank you, thank you. So if we do, oh, and I have to do a calculation. Ah, what am I gonna do? Shoot, what am I gonna do? This will not be my last live. Am I lagging for you? Oh, okay, good. It's not lagging. Great. Okay, so let's just do this first. Let's just do the masseters first. Let's just get those over with, okay? So first, we're gonna do. I'm gonna use a 3 ml syringe. This is Letybo. I'm just gonna get 2.5 real fast. So 2.5 equals 1 ml. Oh, sorry, 100. So I'm gonna just do 50-50, okay? You don't want to do it with this 27 gauge. So I'm gonna switch that out for a much nicer gauge. I do end up, these are really large. These are 1 inch 30 gauge needles, but they work really well for this. So I know it it looks really big, but it is big, scary, you know, but okay, so I'm actually gonna use mine. Oops, we don't want to waste any of that. Oh shoot, I should put too much. Okay. 2.5. Okay, here we go, everyone. Let's do it like this. Okay. I actually like to bite down on something, so I'm gonna bite down a needle cap. Ah! Okay. You gotta make sure you do it 1.25. Okay. So you need to do this, yeah. Right. That's smart. See? Ready? Done. Next side. Go. Here we go. Here I go. If you can't get out. Ready? 1, 2, 3. Third one. Right? This is just outside. Okay, here we go. Just dropped it. But I need a cap. I need some of the choo-choo. Where my choo-choo at? Give me a little choo-choo. Okay. Okay. Oh. Okay, that was done. Master done. Woo! Oh, okay. Here's another syringe. I just like, you know, how much. Okay, so I usually do 20, 25, 45, 65. See, it's too confusing with like, oh, here they are. Okay. So it's at 50 ml, so that equals, so every 30 units on an insulin syringe equals 12 units, so perfect. So angry. Speed running it. So I'm gonna go down. You ready? You go right on bone with this one. You ready? Right, do grab it like this. Perfect. Oh shoot. Those ones always squirted out everywhere. Let me find like my goodness. Oh, come on. Where are you? Here's another one. I'm still here. We're almost done. I can do this in 10 minutes, I swear. And then I gotta go. Bestie's birthday, best friend from childhood. So I got it right in the posteriors. Let's see this. Okay, so this is like a hard part. I only got 10 minutes. I can do this though. I love that you're watching this. Cam, Mike, Mike, thank you so much. Okay, so I'm gonna go right here. So you got to like, the thing is about this, like, okay, you gotta do it like this. You gotta hold it, like, okay. How many units? 50 units is a lot, right? You do 20, 320, do 12. You got a medial. Can y'all see? Oh wait, you can't. I gotta make sure like these are all seen. Look at that. Ready? So I always put a divider like right here. Stop. Okay, so like that divider, that blockage I put, prevents it from diffusing into the. Oh, that's so sweet. You're the best. That's so sweet of you. It's like a divider to prevent it from diffusing into the orbicular. the orbicularis oris, it's called the Mueller's muscle. It's the one that lifts the eye. That's what causes brow ptosis. There you go. So that was around 20 minutes there. This side's done. Let me clean it up so I like know what's done and what's not done. Okay. Where you at? Where you at? Oh, I just like want to know what's done and what's not. Okay. And it really works fast, like for real. Like it starts to work really fast, which I love. I mean, the Botox that it really did go bad. Like it totally went bad, unfortunately, because of the refrigerator, and then I don't get reimbursed for it. So I lose out hundreds, thousands, thousands of dollars. Gone. Okay, here's like another one. We got this. I can do this. Oh, I'm not gonna make it. Oh, I got grape juice everywhere. I just dropped grape juice everywhere. That's great. Isn't that cute? My mom loved drinking grape juice and she had me as a kid, a baby. In the world. I love grape juice growing too. Go, 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 go. Go, 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 go. We gotta go, we gotta go. 50, good. We're gonna do the same thing on this eye. This eye. Okay. So I got when you're doing it yourself, because you are a professional. Remember, this is not for just normal people. Please do not copy me because you will destroy your face. Trust me. You always gotta make the blockage like that. Okay, trust me. It's gonna be hot today. Shit. I had no idea. Damn, okay. Well, it's 9:30. Shit, I still gotta do. Well, I gotta finish what I started, you know. I can do it fast, but I did not do it in my amount of time I thought. I'm just so peculiar. Everything's becomes my own talks. So I did like do like these are like the major areas that are bothering me, like for real. Because I could like tell it wasn't working, you know. Okay, you're almost done. You can do this. You can do this. You can do this. You get that. I'm almost done. I gotta go. I really do gotta go for my bestie, but let's do some more. Let's keep going. This is another. What would that be? I did the math before. It was like if there's 50 units, there's 50 units, right? 50 insulin units. 30 is 12 units of Botox. What does that equal? Okay, ready? Okay, 4 at a time. For the eyes. Oh, it's just 20 units each, okay. Okay, let me just do the card. 1. I like how these don't freaking like the 1 ml syringes will like expel it when you're exiting. It's so annoying, but these like I love BD syringes there because they don't like I actually like refuse to use any other type of syringe now because they waste product and then the patient ends up paying for it. It's not fair. No product comes out. You see what I'm talking about? Like, if I use one of these 1 mls, the product definitely comes out. Like, the 1 ml without a fixed syringe, it expels it every time. It's so annoying. When you're exiting, you get to pull back to make sure that it doesn't do it. It's such a nuisance. I just see that. Did it just squirt out of my pores? Are you guys able to see me? Yeah, New York gets hella high. I forgot about that. Living there, I was like, oh my god. My birthday was in June. Thank you, Mike. Oh my god, I know, because I'm still damn doing this shit and I need to go to my friend. I feel so bad. I need to leave now. Oh my god. Okay. Whew, okay. This too. I really gotta go. Ah, it feels like I really need to go. I really need to go. Let's get the neck done, you know, real quick. Let's just get the neck done real quick. 1, 2. Austin. I'm gonna make it. Yes, you're right. 9:41. I gotta go. It's my birthday. Tomorrow's my birthday, but. And I have no money too. Like I'm like the worst friend right now. Just because of school and stuff. I'm just so broke right now. I've never been so poor in my life. Work and school, work and school. I like don't even have money to go on the train. It's embarrassing. I love you too, Mike. You're the best. Thank you. You're so sweet. Oh my God. Nah. Okay, well that was 300 units. Oh, there's a unit left over, right? Okay, done there. I'm not done though, because I need to also do my. So I need one more box. Oh, I have it here. Okay. Let's reconstitute one more. Oh God, my friend's gonna kill me. Go, baby, go, go, go. We gotta go, baby, go. And I'm so poor. I'm poor. Poor as shit right now. God. Okay, so these are numbing wipes. Okay, well they just rubbing all that over. Okay. Oh my God. Okay, where's it? Jesus Christ. We gotta go. My best dude is pissy at me. But I will be back on later. Trust me. Trust me, baby. Okay, I literally need, like, Dusty, forgive that he's running. For real. Please. Please, Jackie, I'm sorry. Oh, I'm trying my best. I didn't even get to do all my treatments. I have so many plans. Maybe I can go to her place and I can do like a live there. It'll be fun. Get more bacterial static now. Pronto. 3 ml. Oh wait, sorry everyone. 3 ml of bacteriostatic saline. So here. So that, okay, so it's usually 2.5 to every. Okay, it's 2.5, yeah. So this is 200 of Letybo. So I'm gonna put 2. Let's just do it exactly on the dot. 2.5. Perfection. Now let's get the Lido. I like to put lidocaine up today for some reason, but it does work. And I use it right away, and it like does really work. I'm actually just gonna like hyper concentrate it. Okay, so we go, ooh, sexy, right? Sexy, mixy. So mixy. I have these really tiny needles I love. I didn't know I still had any left over. Love these. They're 32 gauge, 4 mm. They're the best. Like, I love these. They're from Anton Move Life. They're obviously, this is for medical professionals, so please don't be bad. Please don't be a baddie. Please don't be bad to me. So if 1 ml equals, wait, those things are 50s, right? Like 0.5, right? These are 0.5, right? Yeah, so those are 0.5, right? Hurry up. Everyone, I'm so sorry, I'm so boring. Okay, 1 ml will equal 60 units then. 60. I'm so sorry, I feel like I'm being boring as hell right now. So 1 ml equals 60. This will equal 160. 120, 180, okay, right? 180 is right here. Okay, we're gonna put this to the side. This is 180, okay? What's the 180 for? Probably like the other bitches, like the temporalis. That's right. Did you guys hear that new Madonna album? It's horrendous, except for the Sabrina song. Okay, that's 180, okay? Next. I need a 3-er. I need a 3-er. I need another 3-er. God, my bestie's gonna be like, what the fuck? Look at me. 180. Yeah, she has a new album. It's pretty wild. The Sabrina I love Sabrina Carpenter, okay? Like, I freaking love Sabrina Carpenter. She's my girl. Like, I love her. Okay, like, love her. Love her. Okay? Okay, so 0.5 equals 30 minutes. Okay, so let's do the eyes now. 0.5 equals 30. Madonna gets Botox. Don't you think? Okay, so 30. Let's do that. Here we go. Right on the camera. Here we go. 1, 2, 3. So 25 will equal 15. Okay. Here we go. Oops, sorry guys. I'm a little late. There we go. Sorry guys, I didn't mean to block it. Next. This is me embalming myself while I'm still alive. Embalming myself. No way. Sabrina's like, I like actually both of them a lot, actually. But I love Sabrina Carpenter. She's like thebomb.com. Get the middle. This shit stings. This is to open up the eye. That's perfect. And on the inner corner. Oh, girl. She is very pretty. I agree. She really is really pretty. She's beautiful. Do you watch Euphoria? Oh my god, I'm almost done. Okay. Sorry, y'all. Okay. Hi, son. I am running late. I need to leave. My bestie's gonna hate me. But okay, now we gotta do these awful other areas. Okay, 1, 2, nasalis. 1, 2, 3. Oh shit. Okay. 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 There's that. Okay, last part. Gotta finish this off. Okay, I've done so much, right? Okay, ready? Now let's do the buccinator. How much did I go? 1 ml equals 60 solution. Okay. Around this. We gotta go. Sorry, I'm so boring. I know. I feel like such a bad friend. Okay, I gotta go. I feel I'm a bad friend right now. I know. We're almost done. Ah! Oh shit. I really gotta go. I really gotta go. She's gonna be so pissed at me. I gotta go on the nasal spine real quick. 1 second. Okay, this one's gonna hurt. Are you ready? Oh. Okay, well that one hurt. That one's always the worst. It's like color length even up. Whew, okay. We're almost done. We're almost done. This buccinator. I am the bestest friend ever, for real. Oh my god. I'm gonna show you a lip flip. Just real quick. Oh, gotta go. Quick lip flip. Quick ass lip flip. Ready? 1, 2, 3. Mhm. Oh. Oh, dude. Almost done. Lip flip done. Yay, I'm all done. Okay. Okay.